Good morning. How you guys doing? Happy Saturday. Sorry, I'm just a couple minutes behind, but I had to come to you. How are you guys doing? Welcome to my channel. It is Saturday, July 24th, and we're going to get it started. We're about to get it popping. You guys had really recommended a lot more discussions about how to manage our emotional health. And so I said, okay, let's just do a second round. Before I get started, I'm just going to go ahead and drop the link right now. Okay, and give you guys a little bit of time to come in. So welcome to my channel. If you don't already know me, my name is Dr. Ivie Okundaye Appiah. And we are going to get it started pretty soon, okay? And if you haven't already, like this video. And liking actually is really important because it helps to, tell the algorithm that, hey, this content is important and people really like it. So definitely like this video and then share with a friend. And absolutely subscribe to the channel if you haven't already, and hit the notification bell so you don't miss out on when I'm going live. But usually I put it on my Instagram. It's every Saturday at 12 noon Eastern time. Okay, so I'm gonna just go ahead and do a sound check and an audio check here to make sure we're all good. We're all good. Oh, whoops, sorry. Okay, very good. Perfect. So happy Saturday. Today we're going to get into part 2 of reclaiming the mind, body, spirit, or mind, body, soul. And this is really not a new concept, but I think in the era of the pandemic, this is more modern. We have a better sophistication, I think, in healthcare of the connection between these three things. And many of you guys, I've met you through social media and online, of course, and through our love of my guilty pleasure reality TV. And really what I want to do is use this channel to uplift and educate. Many of you guys have come to me and told me, like, you feel sometimes, some people may feel like, healthcare is not for them. They're a little bit scared to engage with the system or engage with doctors. But I really want to encourage you to allow me and others to support you in your journey, right? So what do I mean by that? I'm talking about how healthcare should really work for you. Sometimes people feel like, oh, I just feel like all these things are happening to me, at me, and I just have to react. That could be true. I mean, and that is unfortunately true, especially if there's like a new diagnosis or new treatment we're looking at. But what I'm talking about is ways to use healthcare actually to empower ourselves. Here, let me include this in my background here a little bit. So that's really important. And we talked a little bit about that before. So this health is really more than just your physical health, like you said, and like we've talked about many times on this channel, it's a mind, body, soul connection. So we're going to continue on. Last week, remember, we talked about ways to nurture and nourish our emotional health. So we'll get into that a little bit more, but also with a little case discussion with particular emphasis on the caregiver. And remember, in the month of June, we talked about the Ultimate Health Plan series for people in different stages of their lives. Basically, I help to encourage a personalized health plan and plan of attack, really, for those people at different stages of their life: the bride, the professional, man or woman, the divorcee, and the new bride, and of course, the caregiver. So we're going to expound upon a lot of those topics, okay? So again, welcome back to my channel. Like this video, and let's go ahead and really get it started. All right. I'm going to go ahead and share my screen. Okay. I hope you can see that. Oh, there we go. Okay, good. Okay, you guys can see that. So, good morning, Queen Riri, and the Gibraltar Medical Group. Good morning. Thanks for joining us this morning. She says, looking gorgeous. Thank you, just for you. Okay, so let's go ahead and get started. We're doing a deeper dive into the mind body spirit connection. Okay, here's the big, a couple takeaways. I just want to spend the next 25 minutes or so going through a couple of slides and sharing my thoughts. And then I want to encourage you guys for sure to call in. I already dropped the link in the chat. So the health, remember, health is a multifaceted state, okay? It's layered. Health is absolutely not the absence of disease. We talked about this before, and you guys know I'm on my channel. What do I mean by that? Much like war is an absence that, peace is not just the absence of war. Just because we're not at war doesn't mean that, a community is at peace. Similar to that concept, health is not just the absence of disease. Just because a person is a size 0 does not mean that person is healthy. So we have to expand our understanding of what health is. And I think, during this pandemic, I think we've had an even more sophisticated understanding of the mind body spirit connection, number one. And number two, trying to understand how we deal with emotional and psychological challenges that can take place. It's not just about losing weight and being in a string bikini. That's sometimes that's really even the least of our concerns at this point in a pandemic. Everybody, I know has at least knows someone who's actually had COVID, or unfortunately had complications from COVID, or even unfortunately died from COVID. And, that's just a common experience. The fact that we're all in the house, we're all in this collective, state where we have to pause. And the world is really, and particularly in 2020, at a standstill. Luckily the vaccine is more available and more accessible. However, I think modern medicine has adapted and is trying to adapt to the changes of what's going on and our understanding of how we link these three things. Just because, again, somebody is a smaller size, and does not mean that they're okay, that they feel healthy. And part of health is feeling comfortable and confident and strong in your own skin. And it's not just your physical body, right, guys? It's more than that. It's mind, body, and spirit. So here are my thoughts. So mind is really a collection and focuses on your emotions and thoughts. And you guys have heard me say this before, that thoughts shape reality. Thoughts shape our feelings. Thoughts shape, our behaviors. It's from our thoughts that we, behave and act in the way that we do. And emotions are tied right along with that, our feelings. So just keep that in mind. Your mind is really the essence of these emotions and thoughts, in my view. Body to me is more about the physical health and disease, and of course that's where most of my training is geared toward, really. So I'm going to talk about this later on in the live, but remember that the leading cause of death in this country is heart disease, heart attack, and stroke. And so a lot of what I do for anybody who steps into my office or my virtual office, guys, I'm going to be working on what are your goals, but also how do I reduce your risk of heart disease, heart attack, and stroke, knowing that statistically and from an epidemiological standpoint, that's something I have to garner about. So we'll get into that. So it's body is what we're used to thinking of traditional health. And again, disease, just because, currently, just because someone does not have COVID does not mean that person is healthy. Of course, there are a lot of other diseases. There are a lot of other things that need to be considered. Caveat, I am not saying that all of health is just about, pushing pills and giving a prescription to treat a disease. But again, it goes back to feeling good and using healthcare to empower ourselves, not in a reactionary standpoint, but a way to, uplift and make it work for us. We should have our healthcare team work for us and feel strong, feel powerful, and bounce back to a level of, where we feel comfortable in our everyday lives. And I'm going to try and show you how to do that today and really on this channel. So you're lucky if you subscribe. Next, spirit. Now, spirit to me is more intangible. This is not something we can specifically touch. What do I mean by this is, how do we honestly replenish, renew, and rejuvenate? One of my friends, a couple of my friends who I talk to know I'm always using these three words: renew, replenish, rejuvenate our spirit, our energy, to continue to be us, to continue to do the things that we want to do. And what is our sense of purpose? How do we, how are we anchored on this planet? Now, this is different from religion. I know there are a lot of people from various backgrounds that watch this channel. And so what do I mean by that is, part of health is learning how to clean your slate, okay, and get back to you. So part of what I want to talk about today are the JETS. And if you're familiar with my channel, you're familiar with this concept. JETS is just an acronym to describe these few practices that nurtures wellness overall. And it hits upon all three concepts: mind, body, spirit. So journaling, I'm a huge proponent of journaling, and I showed you guys my journal on my Instagram, and here is my journal. I got one personalized, okay? So I actually practice what I preach. But what I want to just say, there's a lot in here. But what I want to say is that journaling is a way to, cleanse your mind. Sometimes we can have a mind dump, and you can do a whole lot with journaling, a whole lot, and just be able to anchor yourself and figure out, okay, really get in touch with your own emotions and needs. And sometimes it's just a way to get frustrations out of your head and onto paper and just let it go. I honestly like sometimes going back to my journal. Okay, let me see if I can find something. Okay. I like going back through my journal and figuring out at what time things are going on. On my Instagram, I told you I write my, hopes and dreams, things I don't want to forget, right? So actually, I'm just flipping to a page in my journal. I'll just give you an example. Okay, so on January 10th, 2021, I have at the top of the page, The Last Dance, and I wrote my reactions and lessons from watching the documentary, The Last Dance. So I remember writing, I remember what I was doing. I was on a plane actually at this time. And if we have time, I'll go through my journal entry, but actually just reading it right now, it's just, wow, it's phenomenal. Sometimes I just like to go back to capture moments in my life that were extremely powerful or moving to me. I love that. I don't know. Sometimes I have a nostalgic heart, but that's one thing I just wanted to share with you guys. You know what? Let me just pause right there and see what you guys are saying. Okay, so welcome back. If you're just tuning in, welcome to my channel. It's me, Dr. Ivie Okundaye Appiah, and we are talking about the mind-body connection, mind-body-soul connection, and how we can use journaling. So that was the first part of our JETS acronym for wellness, okay? So hi, Queen Riri. I already shouted out Gibraltar Medical. Thank you so much for being here this morning. Gibraltar Medical, I would encourage you to sign up for their YouTube channel. This is actually an amazing organization that's based in Chicago. And what they do is really encourage youth to get into medicine with particular emphasis on those of color, people of color. And so she does a wonderful job helping to connect young children in Chicago to mentors and other people who are physicians and in the healthcare field to be able to get into some of these competitive specialties, especially medicine. So I would encourage you to check out Gibraltar Medical. And on my channel, we encourage women and Black women, anybody to get into healthcare and why it's important. So shout out to Gibraltar. All right. Oh, yay. How are you? Inspiration Z, welcome. Happy Saturday. Desiree, hi, good morning. Beautiful picture. So she says, I will start journaling, but then I stop. I need to keep on it because it was very helpful to go back and see my progress. Thank you for sharing that. Yeah, absolutely. And I've had that issue too. Like sometimes I just miss a couple of weeks. There's no pressure. This is supposed to help you. It's not supposed to be like homework or an assignment. I don't believe in stressing anybody else out. So don't worry. We'll give you some tips and tricks at the end. Okay. Miss Inspiration Z, this is such great info. Thank you so much. I know you're already a subscriber, so definitely tune in every Saturday. Thank you so much for this today. Absolutely. You're welcome. You needed it. Me too. All right. Miss Silver Diamond, hi. Welcome to the live. If you haven't already, definitely subscribe. I'm going to put this in the chat for you guys to be able to call in if you want some, advice or want to just talk through some things, or if you have any comments on the show, absolutely call in. I'll just want to have that available for you guys. All right, so I will, let's see, add this back on. Hopefully you guys can see my screen. Okay, no, let me add it on. Bear with me, guys. And then add the string. Okay, there. Okay, so picking up where I left off, so we were talking about the JETS, or the road to the mind, body, spirit, wellness, philosophy. So the next thing I want to say is exercise. This really hits on actually all three things, but in particular, body, right? So the exercise, to me, this is important because you have to sweat. What I'm talking about is 30 minutes a day for about, let me say 2 to 3 times a week to start. And I want to see people sweat and get your heart rate up by any means necessary. And I really mean by any means necessary. Dancing, even I've seen even pole dancing classes. I mean, hey, whatever, purely from a health wellness standpoint, whatever gets that blood pumping, that's extremely important. We do know that aerobic exercise, is good for your heart, of course. And we talked about leading cause of death in this country, particularly even for Black people, for every rate disease, unfortunately, people of color, we tend to do worse. But I'm just trying to hone in on things that are just relevant, relevant to us, to everybody. So exercise is going to be important. There's also some data about how exercise releases chemicals in the brain that can, give you some sense of peace and happiness. And then also people use it to just cope with stress, cleanse their mind. And, I think you guys are familiar with that. Now, the next thing is therapy. You guys know I'm a proponent of this. I think it's good to have a physician, like a family primary care doctor, a gynecologist if you're a woman, and a therapist. And a couple other things, like maybe I need an attorney on the side and, but anyway, hairstylist, right? But a therapist I think is good. And it does not mean that you're in trouble. It does not mean that someone is crazy. Just, it's not weird to say, yeah, I went to see my doctor. It's not weird. So I know that we're trying to demystify and, take away some of the stigma of seeing a therapist or mental health issues, I mean, to me, it's not a big deal. For me, it's like it's not. Before I went into healthcare, I remember thinking like, "Ooh, that's a little weird." But I'm being in healthcare. It's like I get it. Number one, and number two, over time, I think again our understanding of mental health being important is come to the forefront in our society. So hopefully, it's a little bit better accepted. You do not have to tell anybody. It's no one's business. I'm not saying hide it, but I'm not saying you have to announce it to the world. So sometimes people like wrestle with that, like, oh, I don't want anybody to know. It's nobody's business what you're doing. Okay, you can just keep that to yourself. Now, we talked about this last week, like, how do I find, how do I find a therapist, right? And I talked about, consider looking through your employment. Sometimes they offer some supplemental therapy sessions, or, it's part of like your benefits package. You just sometimes have to inquire about that. That's number one. Number two, the other thing is you can just go out of pocket, and there's a lot of telehealth services that are available. I've seen Teledoc. I've seen other like new programs come up. You can literally Google it for a therapist in your area, but I think it's becoming more and more common practice to just be able to do it online. So if you have any suggestions or ideas of how to find a therapist that have been affordable, let me know. For example, I'm not sponsored by anybody. This is, a channel that's growing and blossoming. I'm not, so I can talk freely. And I will always talk freely. Nobody can buy this channel or influence me. Nobody. Because my priority is you and health and wellness. So anyway, Teledoc, for example, offers, I believe they said about $99 for the first session, and then you can inquire about further sessions, and it can be cheaper. So for some people, that's like a dinner, or it's less than the cost of a hotel if you do that from time to time. So just consider that you are worth it. You are worth the investment. It doesn't have to be this big, dramatic, expensive thing. And, just consider. The last thing I'll talk about on this slide is about developing a spiritual practice. Again, we talked about how do you renew, replenish, and rejuvenate your spirit, your energy, the essence of who you are, almost similar to personality. You know how sometimes people say, oh my gosh, you're a little bit off today. And they're not even like your direct friends. People can sense the essence of who you are in your spirit when you're, tired, not just on your face, but your words, your actions, your behaviors, how you move. People can sense that. So I always have recommended for people to adopt a daily spiritual practice. For some people, meditation does that. It helps to, again, get their mind still. Prayer, for those who want to do that. These are things that I absolutely would love to recommend. Okay, so I will pause there and see what you guys are saying. I just have a couple more slides, and then we can, wrap up shortly. Okay. Okay, you can see me. Thanks, Desiree. Oh, thank you, Gibraltar Medical. I'm proud of you too. This is our platform. It's our community, right? So thank you so much for joining. Okay, so one important point I want to touch on is to understand our history. What do I mean by that is to know your own personal history when it comes to your health. For example, you don't know how many times I've had patients, say that they're on medication. So I say, oh, okay, you're on such and such medication. What do you take it for? Because there could be multiple reasons to take that one medication. And people really do not know. They really don't know. And sometimes, understandably so, people get frustrated, or it's overwhelming, or they're just like, it can be anxiety provoking to engage in the healthcare system and understand. But I really want to encourage all of us, if you're on medications, know what you're on the medication for. What are you really treating, and what is the long-term benefit? And if necessary, what are some of the major side effects? Because you need to be able to watch out for that, right? So I recommend that you should know your own personal history. If you let me just say, you guys have known in the past that there were times I've been dehydrated, which is ironic because I'm a nephrologist, and part of our study is of course the kidney, but having good hydration in the body, because that supports the kidney. So I know about hydration. Intellectually, I know about water, hydration, and how that affects the body. But boy, when you're busy, it just happens. Like, I've seen this in truck drivers, other like high performing work areas, nurses. Okay. And I've learned, keep water around me. So, I've been needing to know, oh yeah, back in 2019, I had to go to urgent care for IV fluids because of dehydration. So what I'm talking about is, if you see a new doctor, or if an emergency occurs, you should be able to kind of recite from your mind, these are the major issues, and this is what's happening to me. These are the tests that have taken place. What did we learn from the tests? And what is our plan moving forward? I'm just giving you an example, okay? The second thing is journaling. We talked about this, but even a food diary, for those of you who really want to understand your caloric choices, that's extremely important. Blood pressure log. I oftentimes encourage my patients to write down their blood pressures, and so we can make adjustments if necessary. And it's really been helpful. And I encourage people to do that, but talk to your doctor. For example, if my patient will bring in their paperwork and say, oh yeah, I think my blood pressure is high or not, I can go back and look at the exact numbers, and we can make adjustments on the medications. And sometimes I go down on the medications, so just keep that in mind. And then the last thing on the slide is just understand your own family history. Sometimes families come in all shapes and sizes, and sometimes, we're adopted, or there's sometimes estranged relationships. But I do encourage to share and have honest conversations. For example, we talked about sickle cell trait in the past. I think it's important for everybody to know, particularly African-American patients or people of color, to know their status, because about 1 in 12 African-Americans will have the trait. And if you have the full-blown disease, because you've inherited a trait from mom and a trait from dad in the classic version of sickle cell, then that is really important to know. And that also helps to predict, and guide reproductive health wise. If you have a sickle cell disease or the trait, what are the chances of a potential child having the trait? And this is important because with sickle cell crisis, they have a lot of health issues, and may be in the hospital for pain crisis. It's a extremely challenging life, and we need to know that. But so my point, though, is to understand your own history, your personal history, journaling and going back, and then discussing with your family members. Even if relationships are strained, I think there's power in understanding that. I know people, for example, who unfortunately, lose consciousness. And if your family member has epilepsy, that's important to know. And which family member? Meaning, is it an immediate parent, or is it a distant relative? The more immediate in the family, oftentimes the more substantial it seems to me as a provider. So I need to know that, like, oh, maybe there's a connection. And sometimes we don't even know that. Another example is even something like lupus. Maybe you had one family member who had this unusual heart and skin problem. You never figured it out. Then another family member all of a sudden is on dialysis because of lupus. And then you are, you as a patient may just have some skin issues and feeling fatigued, and not even put those it's not even on your radar. So I think it's important to understand what's going on in your family. I also understand that, of course, health information is private, it can be personal. And oh my gosh, sometimes it can break a lot of drama, honestly, much like weddings, funerals, right? It tells a lot about the dynamics of what's going on in the family. I'm telling you, in healthcare, absolutely. Oh my gosh, I've had some very colorful, family meetings where, you kind of understand, oh, okay, what's really going on. But you know, I will say that sometimes if someone is sick and there's a family meeting in the hospital, sometimes when the family rallies together, it's the most beautiful thing. You can overcome conflict because you're pushed together for a common purpose to support, a family member. So I just want to just share that the key is to understand your history. And I think understanding that helps us access wellness and resources and be able to communicate with our healthcare team. So I hope what I'm saying makes sense, or that it resonates with what you guys think. The last thing I'll go into is physical health. There's more, but I think this is good enough for today. Physical health, we've talked about this. Heart disease is the number one killer. And there's a lot of, despite COVID, heart disease, heart disease, heart disease. Just because someone is in the hospital does not mean it's because of COVID. And there's a lot of other things at play here. So I would just mention these couple of things I encourage everybody is smoking cessation, meaning stop smoking, cigarettes I'm talking about. Having limited alcohol to intake, no more than about 1 per day for a woman or 2 per day on average for a man. We've talked about this too, exercise and sweating, get that heart rate up. And I'm talking by any means necessary. I really don't care, as long as you're doing something to work that heart. A heart healthy diet. If you guys want, let me know if you want some recipes or you want to see me cooking. I think that's important, but that also involves low salt, low carbs, low fat overall, and high fruits and vegetables. I like to keep things simple. And then stress management, you guys. Yeah, stress raises your cortisol levels, and it has so many physiological effects on the body. So, and of course, these are all related to mind, body, spirit. Sometimes when we have depressed thoughts, we turn to some of these things on the list, smoking or alcohol or something to cope. Some people have extreme dieting to cope. So I just, or extreme exercise to cope with things that are going on. So it depends on the context, but I just wanted to at least offer that. So I will just pause there, actually, because that's a lot of information. All right, and just kind of wrap up and see what you guys are saying. Okay, perfect. So feel free to call in. I would really love to hear from your thoughts, your reactions. Okay, and to just tell me what you think or if you have any questions. So, and the last few minutes, I'll just touch base with you guys and then we can wrap up. Okay, beautiful Kimmy. Oh, hi, good morning, good morning. Right, okay, so she says it's easy to neglect your body, have to make it a priority. Absolutely. And I think all of these, you are the priority at the end of the day. I am always talking about this on this channel. And I think that's why sometimes we have so much conflict and weight in our mind, like guilt and stress. It's sometimes we have competing priorities. And when you don't choose yourself, it shows up in your life. I'm telling you. I'll give you an example. A common scenario that happens. Like I oftentimes see sometimes older women all of a sudden in my office, and there's been a new diagnosis, and they're like, oh my gosh, I've been worrying about my spouse my children who are now adults, and I noticed something, I noticed a lump, or I noticed something was off, but I just didn't, I pushed it off, I pushed it off. That's a common one. And, anybody who has responsibilities, it's a common thing. Men and women both do it. But, sometimes women, we're nurturers and we nurture others before we nurture ourselves. We shouldn't. Anytime, I've said this over and over, anytime you're responsible for anybody else or anything else, you have to give yourself a double dose or a triple dose of love, self-care. Anything you would do for your family members, or I want to do this for my family, my child, you have to do for yourself at least twice. And I mean that, and I stand by it because, as they say, like a happy wife, happy life. But even in the scenario where they're preparing people for emergencies on an airplane, right? They're always saying, put on your mask first and then assist, your neighbor. Because if they're always saying that. And it doesn't mean that other people are not important, but you are the representation of your spirit in your own life. And so you have to nurture that and cultivate that first. I truly mean that. And I stand on it. And that's the benefit of being on this channel and watching today is we're going to break it down in different areas of life. How do you choose you? And you will see the health benefits and you'll see the emotional benefits, emotional, physical, and body benefits. I'm telling you. And part of that is being in control of your time and being in control of your choices. But anyway, I could go on and on. Okay, beautiful Kimmy says, I always wondered if autism is hereditary or is it a birthing defect? That's a very good question. Let me do more research about that. I think it can be. It can be, but that's not really my area or my level of expertise. But yeah, beautiful Kimmy, let's talk on Instagram, okay? I definitely want to be able to answer your question thoroughly. Hi, Bishop. Hello, Dr. Ivie and everyone. Thank you so much for joining. Absolutely. I really love Bishop's work. He is in the manosphere sector where they actually talk about, health topic. They talk about basically the 10 life values, and this is really consistent with what they do over there. And there's particular emphasis for his brothers, but also women are a part of that platform. So I definitely support Bishop. I would like to encourage you guys to check out his channel. By the way, I just have to mention to you, Bishop, while we're on here, I really liked your last live analyzing the Richard Sherman situation. I may actually end up doing a show about that, just that alone, and breaking it down. But anyway, welcome, Bishop. Definitely support Bishop's channel. All right. So I'll leave that link up. If there aren't any more questions, I'll be closing shortly. If you'd like to call in, this is the last call, okay? Here we go. So Gibraltar Medical, these are amazing tips. Know your history. Thank you. Thank you. I actually had a couple more cases, but I think I think I'll have to save them for next time. I don't want to overwhelm you guys. Really, this is supposed to be an easy breezy, fun, just a few minutes to talk and build and form community. So there's more coming. Absolutely. Thank you so much. Just understanding the mind, body, spirit connection and how we can facilitate the union of all these things, right? It's not easy, right? In life, it's hard. Inspiration Z says, I've begun the journaling journey, often without being consistent. Thanks for the reminder to do this consistently. Well, yeah, it's my pleasure. It's my pleasure. And again, I don't want to, make people feel down, like do this, do that, do this. I'm just trying to offer practical tools that we can employ and make these things work for us. Okay. And now that you brought up the journaling thing, okay, I'm gonna go back. Okay. I'm gonna go back to my journal. Oh my gosh. My husband is probably watching this. I told him about what's in this journal, but some things in this journal. But I want to just go back briefly, unless there's anyone now. I'm going to go back briefly to that entry. Okay. Wow. Okay, so on January 10th, I wrote The Last Dance. And I honestly wrote, I'm a star. And the reason I wrote that, now remember, this is like my reactions to what I saw in the documentary, The Last Dance. Are you guys familiar? Can you just write in the chat? Are you familiar with that, the documentary, The Last Dance? It's about Michael Jordan and the others in, NBA players and their experience. It was huge. It was huge, like a 10-part documentary. So I was watching it on a couple of long flights. And I wrote, I'm a star. And the reason I wrote that is because Michael Jordan truly is a star. And it appeared to me that at a certain point, he knew it and had to embody that. Okay. And I wrote, personality equals currency equals magic. I wrote, confidence, arrow, excel. I wrote, charismatic talent, respect for teachers, being competitive, hard work. I underlined this, actions greater than words. Sometimes less talk and more action. Wow, this is interesting. I wrote, give it 100% each time and circled it. Eliminate distractions. There is nothing like ownership. Nothing like ownership. And that was in reference to Scottie Pippen's situation. I could do several videos on just that documentary alone. The other thing I wrote is respect your co-stars. Like basically, if you're on a team, and almost everything we do is involving other people, your team, your environment, right? Your family. I said you have to respect them. To get respect, you have to give respect. That's absolutely true. And I saw that, Michael Jordan understood his strengths, but understood the strengths of others around him. So even if he could take a shot, for example, he would see what's best for the team. And if it did not involve him, he would pass it. So there were just so many amazing things from that documentary. What did I write? Contract review. Yeah. Know your strengths and all other strengths. Sometimes perception is more important. Interesting. Accept people's uniqueness. Mental focus of the game. I put in capital letters, ownership. Another one, pick your battles. There's a couple more things in here, but I learned a lot from that documentary that I thought I could apply to my own life. I'm not really into sports or anything, but I felt that the movie was relevant to anybody, especially for those who are shooting for the top, who have goals and who have aspirations, and you have to, have that level of dedication and sacrifice. So anyway, and some of my dreams, when I wrote that, I know where my head was. I always want to give 100% my best. And with my fellowship, just be a leader in the field. Absolutely. So that's why I'm really working hard on my research to improve outcomes of pregnancy in women with chronic kidney disease and better understand fertility issues. So that's why I'm grinding hard. I'm grinding really hard, and other avenues to help people. I want to give it my all. So that's where my head is. You guys know a little bit about me now. So Just being honest. But yeah, not easy. Okay, so thank you, Inspiration C. You reminded me about that journal entry. I just wanted to be transparent with you guys because this is our, little family over here. So yeah, the Bishop, thank you, Dr. Ivie. I appreciate it. I got your back. Beautiful Kimmy, I heard but didn't get a chance to watch. I think you might like it. And I'm not a sports person, and I generally hate sports movies, but this is more than sports. It can be applied to any industry, to anybody. Haven't watched it? Yeah. Check it out, maybe. Okay, Bishop remembers that documentary anyway. Beautiful Kimmy, I'll probably end with you. So I like how your journal entries like bullet points, lists. I think I can do that rather than writing a book. Yes, this is for you. This is not an assignment. It's not supposed to be pressure, just easy breezy, something light and fun. And you can, like I said, go back. So I might share more journal entries. Let me know if you like that or if it's like, it's too much, but I'm trying. I just want to be transparent and be real with you guys. Like what I'm actually saying, I will either tell you I'm doing it or I'll say this is something I'm working on. So it's us together. All right. So with that in mind, I want to encourage you to follow me on Instagram. Definitely. So I put that in the chat there. So at Dr. EBAOA. I'm also on Twitter, but prefer Instagram. If you haven't already, like this video, and we'll catch you next week on Saturday at 12 noon. Let me know if you have any topic requests. There's so much going on. And if you want to chat one-on-one, I'm also available for you. And people have generally really, really found it to be helpful, okay? Thank you so much. Again, my name is Dr. Ivie Okundaye Appiah, internist and nephrologist, meaning I specialize in dealing with adults and kidney disease. And this is our platform and, it's blossoming. So please, 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 guys, I am trying to grow this platform to at least over 1,000 subscribers. So we're getting there one by one. So if you found this to be helpful, please share this video for sure. And then I'm available for you guys on social media and available also for one-on-one, like, consultations and things like that, or just advice or, to be friends and stuff. So let me know how I can be of help for you. So we'll catch you next time. Like, share, and subscribe. And we will see you next week on Saturday. All right. Thank you. Bye.